Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more educated you. Let's talk about calves and calf reduction. Because recently I saw a world-class ballerina who has an amazing body, but she's got big calves, and she's no longer a ballerina. She's now doing something else. And she said, I would like to get my calves reduced. And of course, there's an array of ways to do that. And you say, well, why in the heck would anybody want to reduce their calves? Well, not many guys will do it, but I think, sometimes women will want to do it. And in the past history of doing calf reduction has been awful before the advent of Botox, which is a neuromodulator that helps to actually shrink the muscle. So it is pretty powerful. And so there are a lot of different ways of doing calf reduction. But the most benevolent way has been Botox. And here just an example from the internet of doing a calf reduction with scars. And of course, this is not something that you normally would want to do, but in a patient that has massive weight loss, yes. And I've done these in patients with massive weight loss, but in a patient that actually has good physique, but just has strong, full muscles, big gastrocs from whatever, being a gymnast or whatever. Mainly I see they've been gymnasts or they've been ballerinas. They have very strong calf musculature, their lower leg, and because that's what they've been building and doing is in their professional career. But this is really, in a non-massive weight loss patient, is really not an appropriate procedure to do, because all you have to do is show them these scars and they go, wait a minute. So this is not appropriate, especially not for my ballerina patient. So, but other things that are fairly appropriate in patients are liposuction. Now, liposuction, if they truly have redundant fat in that area and they're younger, liposuction will work. And again, this is from the internet that actually shows a significant reduction with liposuction. Now, you have to be very careful when you do liposuction because the swelling in this can be prolonged. And you have to wear compression garments for 2-3 months. So this is not a small little procedure. This is a significant thing because guess what? We walk every day on our legs and they're swelling, and so the swelling is not insignificant. So liposuction is also a great option for this if you have a lot of fat in that area. But really what I'm talking about is in patients that really have very, very muscular legs, and they, like the lady on the left, and then they just want to look a little more feminine or a little more shapely, and that's where Botox, which is a neuromodulator that really helps to shrink the fat, just like shrink the muscle. And really, it does so in a very benevolent and safe manner. And I know that there's been also studies to show where people actually have cut out the muscle. And there's, especially in the Asian literature, before the advent of neuromodulators, people would actually cut out part of, there's a medial and lateral gastrocnemius, which of course, that is not an operation that I would recommend at all doing, especially in the age of neuromodulators. So I would take that off your board for doing that. So, but I think it's a really, it's an important thing to do. So the big muscles are the gastrocs. There's a medial and lateral head of the gastrocs, and these are the very powerful workhorse muscles that you need. And basically, these are the muscles that you can inject with a neuromodulator. And I'm going to show you a patient that I did that with. And that really helps to shape and contour the leg very, very nicely in a very safe manner using a neuromodulator. So these are the lateral and medial head of the gastrocs, and you inject them when they're contracted. And so and these are deep muscle injections. They're about 100 units per leg, and so it's not an insignificant amount of neuromodulator. And it really does not. It shrinks the muscle. It's much like the Barbie talks of the trapezius. You have to put in 50 to 100 units to actually see a shaping in that area. So I think that's very, very powerful. So this is the area that you inject in the gastroc, and they're done with a little longer needle with a neuromodulator. And I'm just going to show you an example of a patient here that I did that on, and just shows you. And And basically, what I'm doing is I'm using a little longer needle than I use for Botox in the face, and I'm putting in 50 units in each muscle in a segmental manner, and doing that with the patient in the exam room, and they're actually standing, and the way I mark their muscle is I have them go in their tippy toes. You can see that. So you can see that, you can shape it and contour it, and it's pretty impressive. So I'm putting 50 units in each gastroc in a segmental manner in that area, and that really is powerful. So this is truly the optimal way to correct muscle hypertrophy in the calves. Now remember, if you have redundant skin, you got to cut it out. That's a massive weight loss patient. And if you have fat, you got to suction it. But this works amazingly well. Amazingly well. And I think this is the great thing about that. So, and then this is an example again of doing a neuromodulator. And when you have a patient that actually has, you know, well-defined muscles, these are ideal for that. And I do this probably 5-6 patients a year, and patients actually are very appreciative of this because they've been to see physicians that want to do surgery or, you know, liposuction. If you have muscle hypertrophy, you shouldn't have liposuction, and you shouldn't have surgery to do that because, first of all, that's very disfiguring and deforming, and you can really get into a lot of trouble. So this is an ideal way if you want to get more shapely lower legs, especially if you've been an athlete, a professional athlete like ballerina or a gymnast all your life. So again, these are just things that really help you stay safe and stay educated on what's possible and what you can and cannot do that's safe and really reasonable to do. So know before you go, find an excellent injector that knows the anatomy, knows how and where to inject it, the amount, and then follow up with you appropriately. So know before you go, give me your comments, give me your thoughts, and until next time, stay safe, stay informed.